What your period blood color reveals about your health. Your menstrual cycle is not just a recurring biological event, it's a monthly health report. Menstrual blood color is a lesser known but no less significant indicator of what's going on inside the body, even though many people concentrate on flow intensity, cramps, or timing. Differences in period blood color can provide insight into hormonal balance, the possibility of infection, the presence of nutritional deficiencies, or reproductive health, much like differences in skin color or nail quality can provide insight into internal health. In India, where menstrual health is shrouded in silence in many cultures, being able to understand what's considered normal and what may not be can be a powerful first step towards early intervention and better overall health. Dr. J. Ravichandran, Amrutanjan Healthcare helps us decode the color palette of a period. Bright red blood, a sign of fresh, healthy flow. Bright red blood is often seen in the early days of the menstrual cycle, typically days 1 to 2, when bleeding is heaviest. This shade denotes fresh blood, indicating rapid and effective shedding of the uterine lining. This indicates normal hormone activity and good uterine health. However, conditions like uterine fibroids, endometrial polyps, or hormonal imbalances may be indicated if the flow is extremely heavy, requiring changing pads every hour or accompanied by large clots. 1,824 of Indian women in their reproductive years experience heavy menstrual bleeding, which is a common cause of gynecological consultations, as per recent reports by Journal of Midlife Health. Dark red or maroon, slower flow or overnight build-up. At some point in your period, the blood may darken to a dark red or maroon color. This is simply blood that has had longer to oxidize slightly, as it has taken longer to leave the uterus. This darker color most commonly appears in the final days of the cycle or after waking. In most cases, dark red blood generally appears to be completely normal, but if it is accompanied by pelvic pain, an unpleasant odor, or lasts longer than usual, it could be associated with retained tissue, which is a particular risk after childbirth or a miscarriage. In these circumstances, it is important to see a gynecologist. Brown or rust-colored blood, old blood from a previous cycle. Brown or rusty blood is commonly older oxidized blood that did not leave during the last cycle. It is often noticed at the beginning or end of the period, and sometimes just as spotting between cycles. Generally speaking, this is usually not a problem. Spotting, particularly as brown spots, can indicate a thyroid issue, hormonal contraceptive side effect, or polycystic ovarian syndrome (PCOS), especially if you have irregular periods or pain in your abdomen. In fact, nearly 20 of Indian women of reproductive age have PCOS according to the Indian Journal of Endocrinology and Metabolism. It is important to be aware of these symptoms. Pink blood may indicate low estrogen or nutritional deficiency. Pinkish blood is frequently the result of blood diluted with cervical fluid, usually seen during lighter periods or spotting. Consistently pink periods may indicate low estrogen levels, which can be caused by eating disorders, low body weight, or excessive exercise, though they may be normal for some people. In India, pink menstrual blood can also denote low hemoglobin levels, as anemia is affecting more than half of the women between the ages of 1,549. It is important to pay attention to any other symptoms, such as fatigue, dizziness, or breathlessness, and to request a blood test if the pink spotting persists. Gray or off-white clots requires immediate attention. The appearance of grayish blood or tissue during menstruation can be a medical red flag. This coloring can point to a bacterial infection like bacterial vaginosis (BV), which is usually accompanied by an unpleasant odor, itching, or abnormal discharge. Gray tissue may also indicate retained products of conception in postpartum women, which necessitate clinical care. According to the World Health Organization, untreated reproductive tract infections among women in developing countries represent one of the leading causes of infertility and chronic pelvic pain. You should go see a gynecologist as soon as possible if you experience any gray discharge. Black blood, retained blood, and possible cervical blockage. Seeing black period blood can be alarming, but usually, it is simply older blood that has stayed in the uterus longer than normal due to cervical stenosis, accumulation of endometrial tissue, or even a lighter flow. If the black blood is accompanied by severe cramping, cycles are irregular, or there is a foul odor, it could mean a serious problem, like endometriosis, fibroids, or an infection. Noticing these behaviors can be the first step towards early diagnosis. In India, these conditions are often underdiagnosed because of stigma and low awareness about women's health issues. Let your body speak. Swipe left for next video. Menstrual blood comes in a spectrum of colors, each one a potential signal. Even though the majority of variations are benign and a natural part of your bodice rhythm, you shouldn't disregard any persistent changes or concerning symptoms. In India, menstrual health education is still a major obstacle, particularly in rural and low-income areas. Understanding the color of your period gives you the ability to recognize warning signs early and take charge of your own health. Whether you are a mother managing cycles after giving birth, a working woman, or a student, it's important to know what's normal so that you can safeguard your fertility, comfort, and long-term menstrual health. Latest blogs.